So basically, as the name itself indicates, there are various organs which are very famous for regulating their own blood flow. So they don't really need a lot of external nervous system or hormonal input. They are just sort of master of their own blood flow destiny, and they do a pretty good job. So if you check this out, it's a very nice graph showing you autoregulation. Uh, we increase the mean arterial pressure, which is like the feeding pressure, to whatever organ, and check out how the blood flow changed. So as soon as it hit around 50, right up to 200 or a bit more, look at the graph and look at the acute red graph first. Okay, we'll talk about the green dotted one later. So look at this. When the pressure was increasing below 50, blood flow to the tissue was increasing as well. Okay, but as soon as the mean arterial pressure hit 50, the curve sort of flattens right up to an extremely high value of around about 200-ish mmHg. Now, it's not a flat curve, but it's relatively flat if you compare it with this part and certainly this part. Okay, so this is autoregulation, this part here. So you are increasing the mean arterial pressure, i.e., the feeding arteries. You are increasing the pressure in the feeding arteries, the big arteries, or even the medium arteries. However, beyond the meta arteriole, there is something which is resisting into transmitting this pressure in this huge range to cause any significant increases in blood flow. This is brilliant. And this is what autoregulation is. Kidneys, brain, heart, skeletal muscle, they all exhibit autoregulation, especially the kidneys and the brain. The heart as well, yes. Okay. Uh, Look at the green dotted line now. It shows you the same autoregulation phenomena, but it's much more accurate, efficient, uh, on the dot. So the blood flow does increase as it does in acute change in mean arterial pressure. However, the autoregulation bit, the stopping of increasing of the blood flow, really is enhanced in the long term. What we mean basically by acute and long term is if the acute increase in blood pressure was later on sorted out, and now the blood pressure has dropped back to its original situation, and this whole acute thing lasted seconds or minutes or maybe some hours, and then everything came back to normal. Okay, that's acute. However, long term here means that the blood pressure fluctuation was spread out over months to years, maybe. So that is the context of this graph, and that is how it's important. And you can imagine that blood flow uh, in the long-term scenario is much more stable, which shows you the resilience of the auto-regulation mechanisms in these very crucial tissues. Okay, this point cannot be over elaborated. I will inshallah mention this when I discuss the long term mechanisms, hopefully if I remember, but this is an important point to note.